quality, environment, health and safety, food safety, project management, Six Sigma, HR, and soft skills. We are serving almost all the sectors, and our clients based are in Saudi Arabia, Bahrain, UAE, Qatar, Oman, and Pakistan. We started our company in 2005, and our offices are in Bahrain, Saudi Arabia, Pakistan, and Canada as well. So let me introduce our presenter today. Can you change the slide, please? Uh, okay, fine. So Mr. Zia has a vast experience in the healthcare education management system. He is MSc in environmental sciences and is having more than about 20 years of experience in quality, environment, health and safety, especially in the healthcare management system. Currently, he is associated with a very prominent healthcare institute of Saudi Arabia, which is the National Guard Hospital. And I welcome him on this program. And I would like to give the presentation now to Mr. Zia. Zia, could you just give 1 minute, maybe a brief introduction of yourself, your background,
Sure.
and then you can start the.
Thank you, Mr. Asim. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Ziaullah Khan, and I'm currently working with National Guard Health Affairs, Ministry of National Guard Health Affairs, from last 10 years. And my experience including petrochemical, manufacturing industry, process industry. And from last 10 years, I'm affiliated with facilities management and safety. And actually, I'm responsible for accreditation of international certification, local certification of Saudi Arabia, and laboratory certification, pathology especially, healthcare pathology certifications, CAP, American certification actually. So I'm working here as a facility management safety. And today my topic is regarding healthcare facilities management, waste management. Okay, as you know that healthcare facilities, they are generating a lot of type of waste. But the major concern that I feel that want to discuss, in this forum, that is healthcare waste management. Healthcare waste actually, we are calling this waste is regulated medical waste. Regulated medical waste is one of the major issue in all healthcare organization, even in Pakistan is one of the major. But other than Pakistan also, the issue of regulated medical waste is one of the major concern. Because, the cost of processing, the cost of treatment of this regulated medical waste is very expensive. And if you generate more waste, as per WHO guidelines, and you will not fulfill the requirement of per bad waste quantity, you will generate more and you will pay more as well. So from last 5 years, I'm working on it, that how to reduce the waste. I did a lot of things like how to minimize the waste, how to control the waste, regulated medical waste, and how to treat it. So finally, with the help of the management, and I decided that we can reduce the waste in a smart way. Like if we treat our waste within the facility, regulated medical waste. If I'm talking about the waste, it's mean regulated medical. If we, treat our regulated medical waste within the facility, that we save almost 80% of the cost of the healthcare facility in terms of they are paying to waste recycling contractors. Okay. Here in different countries, there are different regulatory bodies. They are monitoring the whole activity within the healthcare facility, and after the dispatch of waste from the healthcare facility to the disposal sites. Okay. The disposal sites normally with the contractors, and contractor, they are the one who manipulate or who can not treat properly the waste, and they just dump the waste in abnormal ways. which create environmental impacts, health impacts and other things. So my first slide, that after this presentation, you will learn that how, if we treat the waste within the facility, what will be the advantages. Okay, first of all, that minimal human health impact. Like suppose if you treat your waste within your facility, the impact will be very low, because the waste will not go outside the facility, and once you receive the medical waste within your storage area, you will treat it and you will dispose of as a general waste. How you will dispose of it, I'll explain you in next slides as well. Minimal environmental impacts. The second thing is environmental impact. If you treat your waste in a proper way, and you are make sure that the microorganism and the disinfectants are up to levels, WHO guidelines levels, that your environment will be safe. Cost effective, definitely. In not like Saudi Arabia, the cost of processing of 1 kg regulated medical waste is around 5 Saudi riyals, equivalent to 1.5 or 1.3 dollars per kg. If suppose any organization, they are generating around 500 minimum, 500 kg per day, so it's really expensive that if you are paid with reference to with respect to the $5 5 real per kg, and you paid for 500 kg per day, so it's really a big impact on your cost. So easily, okay. And then once you process your waste, what will happen? The quantity of the waste actually in big bags, once you process, through sterilization, through shredding, the size of the waste will be reduced. Okay. Here the waste, we are selling for general waste is around point something 35 halala, something like this for general waste. So the cost of medical waste will be reduced. Okay, and then you will throw it as a general waste. Next is types of hazardous waste, because I'm give you some brief about it, that what type of hazardous material. Okay, as per WHO guidelines, OSHA and Joint Commission International, that there are different types of hazardous material. Okay, regulated medical waste, radioactive materials, flammable liquid and gases, and toxic chemicals. Okay, we are not going to discuss radioactive materials, because radioactive materials is another topic that this will take time, more than half hour. Flammable liquids and gases and toxic chemicals. Today we just discuss about regulated medical waste. Okay. So if you dispose of your regulated medical waste in a proper way, you will save the health of your staff, the health of your contractor, your patients, your community, and the whole nation. Okay. What medical waste is regulated means from where we are generating this regulated medical waste. Not only the healthcare facilities, we are generating this medical waste in from different places, like infectious and animal waste. That is that this is the part of the research, that some waste is generating from infectious animal waste as well. Human pathological waste, the waste that is normally generated from histopathology labs. They are doing different samples, different tests for different diseases. So one of the waste they are generating from there. Human pathological waste, that one more thing that I want to share with you, that normally the waste that we are throwing in we are using yellow bags for regulated medical waste. But for human body and blood products, we are using red bags for body parts as well. So here in Saudi Arabia, we are not throwing these body parts into the infectious or any other waste. They are burying this waste here and in all Islamic countries as per Islamic laws. Human blood and body products. there is a different criteria that how much blood is you required to throw as a regulated medical waste. The quantity is 20 cc. If the quantity is 20 cc, you will throw all blood and blood products into yellow bags. Okay. So yellow bag, the purpose of the yellow bag is if the quantity is less than 20 cc, you will throw it as a general waste. But if the quantity is 20 or more than 20, you will throw as a regulated medical waste. The second thing about the criteria for this one is if you have a blood in a tissue paper or pillow cover or anywhere, if blood is not dripping, you will throw this waste as a general waste. If the blood is dripping from this one, you will throw as a infectious waste. Okay. Another thing is needles and shafts you will throw as a regulated medical waste, but it's required hard plastic cans and other things. So during transportation and during processing, that it will not damage the plastic bags. Okay. The another thing is culture and stock microbial materials, like the lab, they are collecting different cultures and they are doing different tests and they have some stocks. So these types of all waste of labs, pathological lab will go to the yellow bags.